The world we live in comprises of good, bad, and the ugly. Well, it is fantastic to always dwell in positivity, but there are instances where we are required as responsible citizens to tackle certain issues or at least be aware of distressing activities which take place around us. Social problems are increasing in societies due to various reasons. One of these is alcohol and other drugs, which has lately become one of the biggest social problems in the modern world. This issue is prevalent in developed, underdeveloped, and developing nations in this modern era of globalization. For a clearer understanding on this very important topic, I have with me today Mr.Jomo Uduman, Honorary Director, the Sumithrayo Drug Demand Reduction Program, Mel Medura. Thank you for being here today and having this conversation with me. My first question for you today is to talk a little bit about the history of Mel Medura.
Okay, thanks for asking me that question, because history is indeed interesting. Sumithrayo was started up in 1974 as a suicide prevention crisis center, and I would say it was the first crisis center that Sri Lanka ever had. And as Sumithrayo went on in 1984, which is about 10 years later, they realized that over 30% of suicides were linked to addiction related issues. So that is why the decision was taken to start an addiction center in this building, very building, called Mel Medura. So it was, in the beginning, it was a resident care system where people could enroll for 2 weeks for this rehab program, which was actually very good. But after some time, we found that the people after recovery went back into the environment and were faced with the same challenges. So we decided to change it over to a daycare center, which was done, I think, in 2004, where clients and their families can come in, be counseled, go back and come back again and discuss their successes and failures and get empowered to carry on their recovery program. So that's how Mel Medura really began.
So how do people get dependent on alcohol and other drugs or substances?
Yes, again an interesting question, because it's all about our coping mechanisms. See, if you look at you or you look at myself or people whom we know, they have different ways of coping with their issues. You may want to talk to a close friend and discuss your issues. I may want to get involved in some holistic programs like yoga or meditation. Some others might want to call a helpline like Sumithrayo, and that is the way people really cope with their issues. But some people may want to use alcohol and other drugs as a coping mechanism. So what happens is, it happens as a kind of a choice of a coping mechanism, and which develops into dependency or addiction. So addiction is a process that starts off with a choice and ends up with addiction, which is actually a disease of the brain.
In this field, you come across various types of people. So are there certain characteristics which stand out in terms of addiction?
Yes, of course. In fact, we have identified them, and not only we, but science has also identified it, scientists as well as doctors and other workers in the community. At Mel Medura, we first call the characteristics as the 3 C's. That is the first stage, which is compulsiveness, out of control, and continued use in spite of knowing that it's doing you some harm. So the 3 C's, those are the 3 C's that we always look for. And even if a client has one of those C's, you could say that there is a problem with addiction. See, the other important factors or characteristics are tolerance. Now in tolerance, the person who starts consuming alcohol and other drugs might get a pleasurable sensation with a certain quantity, using a certain quantity. But as time goes on, the body gets used to that particular substance and may need more and more of that substance to have that same kind of pleasurable kind of feeling or sensation. So then they have to consume more and more. So what started off as one drink may you might need 3 drinks to have that same kind of pleasure. So that is a tolerance level which people develop. Then the fourth, is the withdrawal symptoms. That is when the body gets so used to the substance that is being used that if you stop using it, you develop symptoms of withdrawals, which for an alcoholic might be shaky hands or body pains or whatever it is. And as soon as you start taking the substance again, all those symptoms subside. So they are withdrawal symptoms. And the last one is relapse. That is that when you're into recovery, you go into the maintenance mode, and there is a possibility of relapsing. So, and we find that very evident or quite common in people who have recovered sometimes for 2 years and they suddenly slip back into relapse.
Now we are talking about alcohol and drugs, and this topic is a very wide topic. So what are your thoughts on behavioral addiction?
Of course, I'm glad you asked that question, because lots of people leave that out when they discuss addiction, and it's behavioral addictions is becoming quite a big issue or a problem in Sri Lanka and around the world. So we look at behavior addictions the same way as we look at substance addictions. So in Sri Lanka, the most prevalent behavior addictions are social media addiction, right, as you would endorse, or the internet, pornography, gaming, gambling, and maybe on a lesser level of shopping or eating or exercising. Exercising also can be an addiction where people need to go to the gym, right? And if they don't go to the gym, they have like a funny sensation. So that's also an addiction, feeling of addiction. And interestingly, all what I told you about those characteristics are prevalent in behavior addictions too. That is the compulsiveness, you get out of control, you continue to use it or indulge in the behavior in spite of knowing that it's doing you harm. Then you get the tolerance levels. I mean, you might like to use your phone for an hour a day, but suddenly you might want to use it for 2 hours or 3 hours because you're not getting enough pleasure out of it. So that's how it happens really. And the continued use, of course, knowing that by doing it you're causing yourself harm, or your time is being spent unnecessarily, or family is suffering, or whatever it is. And then the tolerance also. And of course the withdrawals. The withdrawals here are more kind of psychological than the physical which you get in the AOD. It's more, you get stress building up, restlessness if you're not using or you're not indulging in that behavior. And of course you get the relapse. Relapse also when you have come through it or you're in recovery mode, you get back to it. So as you can see, that's the same characteristics, except for the withdrawals where instead of the physical sensations, you have psychological sensations.
So in terms of drugs, what are the drugs that cause the highest amount of addictions?
Yeah, okay, so most people link addictions to the illicit drugs like heroin and ice and cannabis and maybe even the pills like ecstasy and stuff like that. But at Mel Medura, most people who are really involved in the process of rehabilitating people will tell you that the highest addictions are from the legal drugs of alcohol and tobacco. So that is left out in the statistics or the data that comes out. So we are very much focused with data, and we know for sure that alcohol and tobacco are the highest substances where addiction is very, very common. So the next, of course, is heroin and ice, cannabis, and then the pills or the party drugs like ecstasy, cocaine and stuff like that.
Now, Mel Medura is a recognized organization. So how do you engage with your clients, and what are the services you all offer as an organization to the community?
Yes, so firstly, it's a free service to the community. We don't charge people anything. People come to us, mostly I would say family members first contact us about a problem in the family concerning somebody who's dependent on a substance. And then they find out what kind of programs we offer. And we help them and tell them and talk to them about how the client and themselves too, the family member too, who can get involved with the program of rehabilitation. Sometimes the user or the client also contacts us. Sometimes people refer to us like from the police, from the courts, corporates refer them to us when they find employees having problems with addiction. And that's how people come into us. Some of them just walk in because we have been here since 1984, so quite well known. So what happens is when people do come in, they are ambivalent. Ambivalence means they find reasons wanting to change, and they also find reasons not wanting to change. So our job here is, or our goal here is to motivate them to change by accepting them, building a rapport with them, not being judgmental with them, talking to them very freely, helping them to unburden themselves, helping them to talk about their past traumas, about the relationships, about, for instance, we ask them whether they are suicidal, we ask them whether they're sleeping well. So it's a huge process and a very interesting process, because the client is also empowered to talk to us in confidence. So little things that they have never spoken about come out during the first engagement. And then what happens is we find out, of course, what is the substance that they're using, how much they consume for a day, and why it's causing them issues. So that entire gamut is covered. And finally, for instance, if we find a person who is consuming half a bottle of arak a day and who has addiction issues, we would not ask them to stop immediately, but we would tell them, okay, look here, why don't you reduce it to a quarter bottle for a week and then come back to us. Of course, we give them other coping mechanisms and assistance in how they can cope with their day-to-day issues, how they can change their behaviors. So they do go back and they do come back and say, yes, I was able to manage with a quarter. So then we give them a next plan after, of course, discussing their success and discussing the challenges that they had. We would give them another plan, maybe, half it now, a quarter to maybe 1/8. And they would go back and come back again and say, yes, I have managed. So that's how we managed to wean them away from dependence on the substance. Same for heroin or cannabis or whatever they're using. We use the same process. And we don't ask them to stop immediately. But of course, there are some people who come with withdrawal symptoms, and then it's not possible for us to engage with them. So what we do then is, we give them a letter that takes them to the Ward 59 or any government hospital for a program of detoxification, where the body is purged of all the toxins. And also, once the detoxification is complete, they don't have the urge to use it for some time at least. Then it's easy for them to come back and be counseled or empowered to make their change permanent.
So my final question for you is, what is a positive message you could give out to citizens of the country, a positive message on prevention, on alcohol and other drugs?
Yeah, I think the messagers that generally go out to the community, not only in Sri Lanka but around the world, is don't do drugs, don't do alcohol, don't smoke. So nobody likes to hear that, really, Nobody likes to hear the fact that, that we should not do this or we should not do that, and what right does people have to tell us that we should not do this. But what we do is, in our campaigns to reach out to the community, we tell them, if you are struggling with a substance and you feel that you are dependent, reach out to us. Never do we tell them, look here, you have addiction issues, don't drink, don't smoke, don't take illegal drugs. And also, another thing that you should not do is to show them images of the substances. That also triggers people to, or maybe it triggers people who are not taking it to want to experiment. Because always these images, especially young people, may feel that through curiosity, they might want to experiment with these things. So we try to avoid using images. Then we also tell the community about the cost of addiction. And once the cost is really kind of explained to people, even the people who come for counseling, they really understand the financial kind of commitments they have towards addiction and what they can do with that money if they really save that money. And we also go into corporates. We tell corporates we are very happy to come over and talk to your employees. We have tailor-made programs for corporates, for schools, and for organizations like Lions Club and Rotary Club and all those clubs too want us to come out and give out messages to the community. So that's how we handle, and we also communicate a lot with the police and with other government servants like Grama Sevakas and the other gatekeepers. I would call them like the principals of schools, teachers. Those are the people whom we kind of really communicate with, and with these messages. I can show you some of the advertisements that we use. You see here, as you can see, we do not ask people to stop or don't take, but we tell them, if you are struggling, please do contact us. And here again, these images may motivate people to want to change. That is what we try and do with people. This is for mobile phone addiction. As you can see, we refer to it as like a prison, and you can come out of that prison if you reach out to us. And here again, and then we also go out into the community, like we go to bus stands, we stand at junctions and give them these cards so that they can, if they know of people who are really kind of into dependency, they can ask them to seek help. And we also give them this card with the cost of addictions. Here again, we educate them about the cost, and they will be able to educate the users finally. So that's the kind of positive messages we take out to the community.
Thank you very much for having this very, very educative discussion with me today, and I commend everything you do and the extra mile you take in promoting good and making a positive impact in our country, and I wish you all the very best in everything you do.
Thank you very much. Thank you very much. My pleasure.
I was in conversation with Mr. Jomo Uduman, Honorary Director, the Sumithrayo Drug Demand Reduction Program, Mel Medura. Rehabilitation has become an urgent need of the country to protect its valuable citizens who are needed to build a sustainable nation that is free from alcohol and other drugs. Well, this is possible if all our citizens work together as one, and if we show our support and contribution, we could bring this to an end. Are you willing to make that change?